Yeah. We'll touch on it all. Let's hop in earnest. Thank you again for taking a minute out for the program. I appreciate it.
Sure, sure, I will.
So let's begin our journey with this. 6 years ago, this pandemic got all of us at kind of a crossroads, big changing point for humanity. How did you get through that era, and how has it changed the way that you do things today?
Well, the main thing as far as my practice, my psychological practice, was everything was telehealth now. That's where the whole thing became very big, you know. And telehealth is okay with adults, but not with children or teenagers. You need the contact with them. Um, when you're in the business that I'm in, you actually have to judge the distance between you and the patient,
Yeah.
client. I mean, I see children down to the age of 3. And so a 3-year-old wants you to be like 2 or 3 feet away. That's it. That's their comfort zone. Whereas a teenager would be more like an adult. And a young woman, especially if she's had any experience with being abused, I back up my chair as far as I can. I mean, because they feel that sense of danger, and here they are in a room with a strange man who they don't know.
Yeah. Yeah.
You see, so COVID, I could still do the work. I do insight oriented work. Yeah, I wanted to talk about the difference between therapy and coaching for that reason.
Sure.
And so I would have to assess who needed to come in and who did. Uh, COVID was, well, it was traumatic for everybody. But ironically, this is a sort of a segue, but actually, you know what became crazy? The prices of guitars.
Yeah.
Everybody was stuck at home, so they decided they wanted to play the guitar.
Uh-huh.
But the workforce was limited because of COVID,
Yep.
and the supply chains were limited because of COVID. And so all of a sudden, a $300 guitar or $1,000 guitar was $2,000. You know what I mean? Because everybody wanted one. But that doesn't bother me. I collected my instruments many years ago.
Yeah.
But anyway, it was so that's a side effect. But as far as relationships, everybody was stuck at home.
Yep.
And that you know much less personal space. And I don't think you need to be a psychologist to realize that you don't have enough personal space. We get surly,
Yeah.
we get testy or stressed. And so, if you study family dynamics, family systems theory, for instance, they talk about a factorial. Okay, Joe. And what I mean by that is this: let's say you have a family of 5, 2 adults and 3 children. How many interactions are going on at the same time when they're all together? 5 times 4 times 3 times 2 times 1. Does that add up to 200 something? I don't know what it
Yeah.
adds up to, but in other words, it's like ping pong balls in a lottery machine. Everybody's bumping off everybody. But affects mom, affects dad, affects kids, comes back to dad, goes back to mom. It becomes stressful. And what happens when we get stressed, it really affects our ability to communicate effectively. Now, there's all kinds of reasons for that. One of the main ones is called regression. Right? What do I mean by that? How we communicate is often learned almost on a subliminal level. You we watch how our parents communicate. Do we developed an emotional language or a common emotional language with our partner or our children? These happen through experiences as you're growing up and as you get married, etc. And if you don't have that, you don't communicate well. And then when you get stressed, you kind of regress back to previous ways of dealing with things, which, you know, how we react to stress, that can vary a lot, But most parents, what they need to understand is how their children react to stress is modeled after how they react to stress. It's called internalization. It's almost a subliminal learning. Okay, it's not even worded. You know what I mean? It's just a reaction because it starts so early. And that's what we regress to. This is one of the reasons why children who are abused and grow up, they will swear up and down and sideways. They never do that to their own kids. But under real stress, especially unanticipated stress, they'll hit again because that's what they And this is how this legacy gets passed on. It's not a good legacy. What I talk to parents about is becoming what I call a soothing presence for their partner and their kids. And this is probably the basis of what I do, to tell you the truth, Joe. Notice that I use the term soothing presence rather than soothing person. And here's why I do that. In this day and age, there are so many stresses on a family: external stressors, internal stressors. I just described, regression. That's an internal stressor, obviously, but job security, financial difficulties, differing personality traits, how we communicate may be different. How we parent may be different between, parents. And it's all bunched together, and there's no respite from it anymore. In the old days, you'd leave, remember that phrase, you leave your work at the office? We don't have that anymore. With computers and cell phones, everything, we're working at home. Sometimes that's all we do is work at home. It leaves little time for personal space, for personal endeavors, to do things as a couple, and especially to have what I call predictable time with your children. Because children need predictable time with their parents. Predictability is the basis of everybody in what we call trust. When you can predict somebody, you trust them. With children, it's not only trust, it's security. When they can predict their parents being there, predictable times, and predict how their parents are going to react, and not just, regress and do something other, they feel secure. So I talk to parents about lifestyles sometimes. You've got to calm things down. You may have to take a lateral move rather than move to Boston to the main office, which is actually a true story. I was seeing two couples in the same business. They were both VPs here in Cincinnati. One, they both had chances to move up the ladder. And in big corporations, that means moving, which I think is not really good, but okay, I'm a psychologist. I don't have to worry about that. But
Yeah.
in any case, one of them did it. They moved to Boston for a, big job. I don't want to live in Boston either. It's too crazy there too. But anyway, his wife left him, came back to Cincinnati because she wanted to be here near her family and was going to nursing school. The other one, his wife convinced him to take the lateral move to move back to, I think, the San Francisco area, because that's where her family was and his family was. They did that. He didn't go up the ladder. It was a lateral move, but they're still together and their kids are happy.
Wow.
See what I mean?
Yeah, sure.
I talked to both of them. You sure you want to do this? And one said, I'm going to do it. One said, okay, I'm satisfied. This is more important. And it was. Because
Yeah,
that guy's up there by himself up in Boston, living in some condo or something.
sure.
I think they're divorced at this point. That type. So he sees his kids during the summer.
Sure.
You see what I mean? It's
Yes.
no good.
Yeah. So, we talked about you're from Brooklyn up in New York, and I've talked about my dad and the lineage. What did you want to be when you were a kid? What was your dream?
That's a good question. I can't say I had an easy childhood. There's always a reason why people go into mental health.
Yeah,
I'm not going to go into that.
sure.
Um, what I wanted to do was get to a different environment. Did I aspire to be a psychologist? Not at first. At first, I was into medical research, and I succeeded at that. I presented this big paper in Manhattan at a big convention. I was 24 years old and scared to death, but I did it. And I was first author on this paper that was significant, which also got me into graduate school, because they liked the research that I did. And but I got tired of the lab. I needed more people contact. I mean, I had a fellowship to continue the research if I wanted it. McGill University wanted me up in Canada to continue the research, and I couldn't do it there because I was an American. They couldn't pay me anything to go up there, I'm a Canadian. But I left research, went on unemployment for a while, and volunteered at a state hospital for adolescents. And I really enjoyed this work. I said, this is something. I became a counselor at a foundation in Philadelphia, and then I finally applied to graduate school and got my doctorate in clinical psychology at the University of Louisville. They paid me. It was an approved program, and it was actually a good education. It really, really was. And from there, I began to actually learn, because you learn from experience. You learn stuff in graduate school, and then you realize, hey, to mature as a therapist, you've got to stay humble. Never think you've got it all nailed, because every person is different. Every situation is different, right? Uh, and so you have to be creative. And I love being creative. Like I said, I'm a musician. I'm a singer, and I'm a writer. I'm trying to, I've written this book that I'm trying to promote vis-a-vis podcasts, which we'll talk about it too.
Yeah.
Um, on parenting for young parents, because the younger you start with the children, the better off you are. If you can be a soothing presence in the beginning and help them develop an emotional language and make them feel safe to talk to you, all these things really matter. It's really one of the, besides, shelter and food, it's really one of the most important things you can do is what you model for your children and how you are. I tell parents all the time, the biggest gift you can give your children is to be okay yourself. And this is often where we get into therapy versus coaching. Okay. For instance, I never see children without seeing their parents. And sometimes I have to see the parents as a couple or even individually, because there are things in their way of being a good parent, being a good spouse. This is the difference between coaching. And coaching is giving advice, and that's fine. But most people come to somebody like me, a therapist, and say, I know I should be doing this, but I can't, and I don't know why. Or I'm feeling this way and I don't understand it. One is a common one is they explain a situation. Does that sound normal to you, Dr. Marcus? I mean, there are these gaps in what they can explain about themselves, and these are what gets in the way of them being able to progress. They don't really know. And some of these things began pre-verbally.
Yeah.
So there never were words for that, or the family didn't talk about these types of things, so they never developed an emotional language to express it. A great example, Joe, of what I'm telling you is what we typically call an overreaction. Somebody does something and the other person, they explode or something like that. Observer goes, whoa, what's the big deal? Why do you get so upset? And then there's that moment where they go, and they feel embarrassed because they really can't explain the intensity of their reaction. That's the gap.
Yeah.
You see what I mean? That's where the work. A very, very good supervisor I had in graduate school, brilliant man. I really liked him. And he turned to me, my third year of graduate school, gives me this question, which I always a pain in the neck. Okay, David, what is therapy? Oh, thanks a lot. Well, we help people. We did, you give him the spiel, and he's just shaking his head like this. No, no. And okay, I give up. What's therapy? He looked at me and says, David, this is it. Therapy begins where the words run out. Think about that for a second. These gaps that they can't explain, but it's preventing them from doing this or making them feel this way, usually very intensely because they're old and unexplained and never been able to be verbalized. That's what I look for. I make note of where these gaps are. I don't know why I feel this way. I know I should be getting a job. I don't know what's getting in my way, which is a phrase I use a lot. Something is getting in your way, as opposed to saying, why don't you do that? They've heard that ad nauseum
Sure.
from everybody before they came to me.
Sure.
If they could explain that, they wouldn't be sitting here
Yeah.
with me. And I tell them that, if you could tell me without, without any hesitation, without any gaps like that, explain everything to me logically, you wouldn't be needing to see me at all. You'd have it all nailed. We're going to go on a mutual exploration find these words and figure out what's really going on. That's therapy. Coaching is saying, why don't you do that and do this and do that and make suggestions? If a person's well put together, they can take that kind of thing and go and run with it. But that's not most of the people that I see. People come to somebody like me, not first, but last. They've talked to their friends, they've talked to this person, that person, they even talk to other counselors or coaches. Something is still missing. They come to me. It just hasn't really done the job or whatever you want. They come to somebody like me and they say, okay, what's really going on? Let's figure it out together. And once they have that, we can start thinking about what to do about it.
Yeah.
Because you're getting from in here to out here in my soothing presence.
Yeah.
Now we can look at it together, figure out something. So this is a process that takes time,
Sure.
obviously. It's not like it's going to be 6 sessions and, bye-bye.
Yeah. Totally get it.
Yeah. And that's with the children is a whole other thing.
Yeah.
Because you got to, what stage of development do the children at?
Hmm.
Have you helped them develop an emotional language? Can you help them to, children? Do you have children, Joe? I'm not sure you have children.
Yes. Yeah. I
Well,
do.
you do. Well, young children experience their emotions very intensely.
Yeah.
You know that, the temper tantrum or whatever it might be. They can't handle that.
Yeah.
They have to sit on it sometimes, or they express it behaviorally because they don't have the words. How many times have you as a parent or me as a parent turned to our kids and said, don't hit your brother, use your words.
Yeah.
Well, I've got news. That's a skill. That doesn't just happen because you happen to have a good vocabulary or smart. That's what a lot of parents think. Oh, my child has a great vocabulary. They're smart. Therefore, they're resilient. That's not resilience.
Yeah.
We can talk about the real definition of resilience, but without him, by being a soothing presence, we can go through the process if you want to, but being a soothing presence helps the child deal with the intensity. They're talking to somebody who's okay when they're not okay. If you think about the people you may turn to, Joe, when you're really upset about something to get it off your chest, invariably there are people, maybe friends or family members, who are okay when you're not. Think about it. The problem is parents don't realize that. They give advice or they try to. There are things that get in the. You want me to go over these things that get in the way? I'll do it even right now if you want me to, Joe.
Well, I will tell you right now, typically the way I do this, I usually allot about a half hour. So I want to make sure I cover the book and I cover some things. We
Oh,
could
I'm
even
sorry.
No, no, you're good. We could even do a part two and kind of delve into some more things, but I really kind of wanted to kind of traverse
Okay.
but so no, we're good. So what I
Okay.
want to know is with the book, how did the book come about? Talk to me a little bit about the book.
Okay. I appreciate that. And uh, I got a big mouth. What can I tell you,
No,
Joe?
you're good.
I'm
You knocked a lot of dominoes down already, so you did great. No, this is good.
okay.
Yeah.
Okay. Okay. Good. The book is called Parent Prescription, Parent RX, and my motivation was very simple. The parents that I was talking to would come in and take notes on some of this stuff, or even record it. Or they call me, or I'd see them and they say, oh, I wish I had you in my ear on Thursday night when my son was having a meltdown, or something like that. They really valued even the phrases I used to frame things for them based on their own children's emotional perceptions, which is a topic that would be an hour just in itself.
Yeah.
But once they understood their children's emotional perceptions, they can gain access to it by being a soothing presence. And then the book explains how to do that.
Yeah.
And I give, examples. Parent says, child says, parent says, child. And I annotated, this is what you're accomplishing. This is why you use these phrases. Your child's experiencing this, and this is why you approach it this way. See, at different ages and different situations. I go over what I call the art of discipline, because discipline is not the same as punishment. I go over the experiences that first build and then maintain self-esteem. And it's not praise, by the way. right? There's a lot more to self-esteem than simply praise. Okay? There's so much in the book. My practice has been dealing with high stress families, high conflict. So I have a lot of material on the impact of high conflict on children and on, and get into some of the legal things about custody, et cetera, et cetera. So there's so much here. And they said, please write it down. So some years ago, I decided, okay, I'm going to do this. I took a year and a half just to research other people out there. There's lots of parenting books out there. And of course, I didn't want to reinvent the wheel, Joe.
Yeah.
And so I think there's something I can add to the vocabulary out here. So I wrote the book. It took me a year and a half to write the book. Then I had to find an agent because when you publish, you need an agent these days. All right. I found a really good one, and she's been helping me to, telling me what I needed to do to get the book published, the website, the trademark, the logo, all that 9 yards, and the podcast. She said, do the podcast. She said I needed at least 4. I got to tell you this, Joe, I'm on 54.
Yeah.
And people really do ask me to come back. It's very gratifying. They think I know something, which is very nice. I'm gratified. But all this is in the book.
Yeah.
When it comes out, and they want me back when the book comes out, this type of thing.
Sure.
So that's the status of the book. I mean, there are publishers right now is taking it seriously. I'm waiting for some feedback from them, whether it's a yay or a nay at this point. And my agent is spreading it out there. And the podcasts have been going well. And I appreciated the hosts that have, been interested in what I have to say. And I kind of clean up a little bit, so I don't look like a New York schlump, and I enjoy talking to people. I'm a ham, Joe. I mean, I enjoy public speaking. I'm
Sure.
on stage. I've had to lead in a number of plays and stuff like this. I mean, I got this checkered past, like I told you.
Yeah.
So that's why I wrote the book. And I think this book is going to be a benefit, especially to young parents, but even for parents of teenagers, because there's a whole section on adolescence as well, and also how to communicate with your partner.
Yeah.
A lot of it translates. So, there's value to all generations. I'm thinking of writing a second book for therapists, because a lot of the stuff even I've introduced here today has to do with how do you do this stuff.
Yeah. Yeah.
And so, and my agent is saying, do that and keep doing these. I appreciate you having me on.
No, you're great at it. Yeah, and I really wanted to open the door to the book and to kind of your world a little bit. So I would like to
Great.
revisit down the line when the book comes out. So if anybody wants to reach out, get on the list to get the book, hire you, any of the good business, where do they go?
My website is parentrx, PARENTRX, one word, .org, parent.org, parentrx.org, excuse me. If they want to reach me directly, it's on the website. They can reach me at dsmarcus, DSMARCUS, PhD, at parentrx.org.
Okay.
All right. And I've had people, getting in touch with me from around the country on certain things about, they listen to these podcasts, and that's great. There's a listing of all the podcasts, etc., on the website too. They can listen to those. I'll be doing that with yours as well, of course. And if you want to continue to part 2, because we actually only got to part 1A,
Yeah.
what I mean?
Yeah.
Invite me back, and I'll be glad to do a part 2. I've done a couple of 3-part ones because there's so much to talk about.
Yeah, there certainly is. Yeah.
Okay,
So we'll pick this back up in earnest and delve into very specifics. So, David, this has been great. Thank you so much for taking a minute out. It's great to meet you. I
Sure.
appreciate it.
No, it's great to see you too, Joe.